just tell me a little bit about the side effects of these PARP inhibitors? Because I'm guessing they have their own side effects.
They do. So PARP inhibitors as a class have, I like to compartmentalize side effects so I can remember them well, but essentially fatigue is a big one. But I like to reassure my patients that although it's almost universal, that we will get you through it. And the reality is, if you look at all the clinical trials that were done, fewer than about 10% of patients needed to come off of therapy altogether because of side effects. The vast majority can be managed with effective counseling, education, symptom management, and medications if needed. The other one is GI side effects, so nausea, abdominal pain, constipation, diarrhea. It can run the gamut, and hematologic abnormalities, so anemia, thrombocytopenia for some PARP inhibitors, lymphopenia for some PARP inhibitors. So we want to assess all of those parameters. There are some very rare side effects that sometimes come across that patients may read about, like myelodysplastic syndrome or AML or pneumonitis. Those are very, very rare, less than about 1 or 2% of patients, but certainly important to bring up. So education and discussion, not all patients, even though I talk to all of my patients about it. Some patients may elect not to do the maintenance therapy, but again, it's about counseling, education, and making sure they understand what the benefits are of this approach.
And I think when they don't want to do maintenance therapy, is it just that they want to take a break completely, like just take some time off? I know you're a great doctor, but not see you for a little bit of time. Take a little bit of a break, not see you that frequently. Is that what the common discussion is?
Absolutely. Most commonly, patients just say, I just want time to not do anything. I don't want to, I know these are oral medications. I don't have to come to the infusion center, but I don't want to have to think about the tablets. I don't want to think about lab work. I don't want to have to worry about coming in to visit you. And so usually, but in all honesty, it's a minority of patients.
Dr. Hirsa, how do you kind of deal with the psychological aspects of kind of continuing something chronic? I mean, sometimes IV, patients come in every 3 weeks, 2 weeks, get the IV and go, and then you're right, they can put in a box, but you're taking a pill every day, right? So it's harder to put that in a box.
It is a constant reminder that there's this thing that could potentially come back and get you. Again, I think focusing on it, that this is a tool we have to help maintain control of it is refreshing now, versus just being done with chemotherapy and waiting, and feeling more helpless about it, but feeling like, oh, I've got this pill. It has this efficacy that can do something, and as long as it's not itself killing me, like it's not causing all these side effects or itself intolerable, it can be good. But I'd be interested, Donia, what your experience has been.
Well, I was kind of caught in the no man's land because I had finished my therapy, and the SOLO-1 results came out for indicating maintenance in the front line for BRCA patients. But we had to discuss whether or not I would go on it or not go on it. And my first reaction was, I want that pill, because I don't want this to come back. And,
very well-informed patient, Donia. Very good. You called Dr. Scandy, you texting, you're like, I want SOLO-1 pill.
Yeah. The day it came out, I got a text. The day that was
yeah. And so that was a long discussion, and ultimately we decided to not take the pill.
Okay.
So I'm not on anything right now, but that was a tough decision.
But I think that's where discussing with your physician, with your care team is very, very important. So you kind of understand the risk versus the benefits, versus what you can do. So I think you exactly did the right thing. Reached out to your physician. You're a well-informed patient, reached out to your physician, talked to them about risk benefits up and down, and then kind of made the decision together.
And I think just an important point is that on the clinical trial that Donia was on, there was a maintenance arm to that trial that was either placebo or drug. And so it made the picture a little bit, it was a unique situation, not necessarily someone who had no treatment at all completed their therapy.
Yeah, I think that's why every patient is different, right?
Yes.
Patients don't read the book. That's what medicine is, a number of unique situations.